Comorbidity of Mental Health and Addictions, created and narrated by Mariah Schaefer. I will begin with a message of hope and positivity. Every person has struggles in life. No matter what they are, nobody is alone. There is help and hope, and it is never too late. Whether it is you who struggles, another person in your life, or if you are just curious about the topic, here is some insight into the comorbidity of mental health and addictions. What is comorbidity? As described by the National Institute on Drug Abuse, a quick definition of comorbidity is the occurrence or diagnosis of two or more disorders or illnesses. Another word for this that is more commonly known is dual diagnosis. Understanding the connection between mental health issues and addictions can help a person recognize why they or others have some of the struggles that they do, perhaps leading to actions being taken. The Center for Addictions and Mental Health provided insight into the following information. Abuse of mind-altering substances is typically something used as an escape, which can be very quickly lead to a dependency of a substance. Generally beginning as a way of coping with mental health issues, even if it is a medical prescription, use of mind-altering substances can lead to the body developing a reliance and becoming an addiction. On another note, the use of mind-altering substances has been proven to lead to mental health deterioration, which can both cause as well as worsen pre-existing mental illnesses. Some other known causes and factors include genetics, like inheriting an addictive personality, as well as environment, like where and who one is surrounded by and influenced by. Types of addictions. Some addictive substances used to cope that can be addicting involve, but are not limited to, alcohol, cocaine, marijuana, methamphetamine, ecstasy, tobacco, and so many others. Types of mental health issues. There are many mental health issues that co-occur with addiction, and a few of those include depression, attention deficit hyperactivity disorder, obsessive compulsive disorder, anxiety, bipolar disorder, schizophrenia, post-traumatic stress disorder, and remember, those are just a few examples. There are many others. Signs and symptoms. There are several indicators that can be red flags to show that a person that may be struggling with addiction. Some of these indicators could be self-harm, memory loss, mood swings and loss of emotional control, high anxiety, feeling of hopelessness, sleep problems, appetite and/or drastic weight changes, irritability, and again, these are only some indicators. Now that we've gone over some of the informative pieces, let's get into some more positive things that can be done. Coping strategies. We are more powerful than we may think. There are many things that can be done, whether it is for ourselves or things to suggest to others who are struggling on a daily basis. Some coping strategies and tools that can be used aside from professional supports and can make one's day more positive and productive include meditation, exercise, eating healthy foods, socializing with healthy people, identifying and avoiding triggers, proper sleep, creating and maintaining a healthy and productive daily routine, removing temptations like ridding of drugs or alcohol in your home, having a safe space that you can retreat to when feeling tempted or triggered, and remember, be patient with yourself and take it all one day at a time. There is help all around us. Reaching out and accessing professional support is one of the most effective methods in taking the road to recovery. A few people or places that you can reach out to include doctors, therapists, helplines, treatment programs and centers, and that is just to get started. There are endless resources to be accessed for both general as well as specific inquiries and needs. In front of you, you'll see a few reliable contacts in Ontario that can provide information on what can be offered and what steps you can take next. Keep in mind that each person is unique. What helps one person may not suit the next, so do not give up. Keep trying. or the next place you go or person you call may have just the thing that you're looking for. Visit these web links if you would like to learn more on the topic that I have spoken about today. Thank you so kindly for watching my presentation.